We can use Juvederm products in many areas of the face. Generally, we use it in the cheeks to contour and lift the cheeks. We use it in nasolabial folds. We use it in oral commissures, and we use it also in the lips. You can also use it to define the jawline and give contour to almost any part of the mid or lower face. So among the Juvederm products, the Ultra Plus cap family can generally be used in the nasolabial folds, lips, chin area, and marionette lines. They're generally in the 9 to 12 month longevity. The newer cross-linked products like Vollure can last anywhere from 12 to 18 months, and those also can be used in the same regions as the nasolabial folds, lips, and marionette lines. And then the Voluma, the Juvederm Voluma, is mainly used in the cheek area, and that's the one that has the longest longevity, which is actually up to 2 years. In general, Juvederm products are made of hyaluronic acid, which is a very safe product. It's one of the safest products that we use on the market, mainly because hyaluronic acid is naturally found in all human bodies. So it's a natural substance that's concentrated and cross-linked so that it basically takes longer for the body to break it down. The Juvederm family of dermal fillers are all comprised of a hyaluronic acid gel, and these are basically clear substances that look like clear jello or honey, and this is a natural substance found in the human body called hyaluronic acid. It's what gives our skin the hydration and suppleness that we have. The main differences between the different Juvederm products are basically the type of cross-links that make it last longer. So the longer lasting products, or the denser products, tend to have more cross-links that link the molecules together, which basically takes the body longer to break it down, hence the 2-year longevity. And then some of the thinner Juvederm products are still made up of hyaluronic acid, but have less cross-links or weaker cross-links that allow them to dissipate over about 9 to 12 months. There are ways to improve the results of the Juvederm by preparing for the procedure properly. For about 1 week prior to any Juvederm injectable treatment, we ask people to avoid anything that thins the blood. So blood thinners include drinking alcohol, taking non-steroidal anti-inflammatories such as aspirin, Aleve, Motrin, vitamin E, fish oils. Those are the most common blood thinners, and as well as starting to take anti-bruising or swelling tablets 3 or 4 days prior. And again, those are generally arnica tablets. You can also take vitamin K supplements, and you can also take bromelain supplements, which are a pineapple extract that help decrease swelling. So those are the type of things that help the result look better and have less swelling and bruising after the procedure. The Juvederm family of dermal fillers have a wide range of longevity. So in general, some of the thinner products last about 9 to 12 months, and some of the denser products last about 24 months. Juvederm is generally considered one of the safest products. It's also one of the products that's been out the longest on the market. The only product that's been out longer than Juvederm is actually Restylane, and both of them are comprised of hyaluronic acid. And again, Juvederm is made of this substance that's very safe. It's naturally found in the human body, and there's really no major long-term complications or side effects. Oftentimes patients will ask us if it's safe to use in pregnancy and or breastfeeding. In general, because Juvederm has not been studied in pregnant patients, we generally ask that patients don't use these products while they're pregnant. However, if they're not pregnant or they're just breastfeeding, These products that are injected stay localized in the face. They don't really travel into the breast milk. They don't travel around the body. So they're generally very safe to use as long as they're in the breastfeeding category and they're not pregnant. Most of the hyaluronic acid injectables, including Juvederm, have a very minimal pain threshold. An average patient may say it feels somewhere on the scale of 2 to 4 out of 10. These products have a lidocaine or a numbing agent that's mixed in with the filler. So as the Juvederm is injected, it actually is less painful than most people expect. It's a quick 10-15 minute procedure. After each treatment of Juvederm, the recommendation is to apply a soothing gel. We tend to use arnica gel. It's an anti-bruising and swelling gel that we apply 3 times a day, as well as icing the area several times a day for a few days. Most of the time, it'll take about 2 to 3 days for the result to really show, or for the filler to soften. When you first apply the filler, it tends to be a little bit firmer to the touch, and then it softens and kind of hits its peak result at about 3 to 4 days. The most common side effects that people will notice are bruising and swelling and a little soreness to the touch. Many of the bruises are very small. They can be as small as a purple dot, but sometimes they can be the size of a dime. Most people can apply either a little bit of makeup over it or foundation, or they can just use the arnica gel. And you can also use oral arnica tablets as well to help dissipate the bruising and the swelling. Occasionally, after a Juvederm treatment, some patients may notice a little firmness or a few small lumps and bumps where the filler or the Juvederm was injected. It's okay to massage it. A lot of times people will use the arnica gel itself as they're applying it 3 times a day to massage with it, and generally it will soften over a period of about a week, and you can massage them several times a day. Other times people want to have a facial or some sort of treatment after the Juvederm, so usually we recommend waiting about a week, because that's when usually the bruising's gone, the soreness to the touch is gone, and the filler is finally kind of settled in. So usually about a week after the treatments, patients can feel free to resume their normal facials. If patients want to exercise after a Juvederm treatment, we generally just recommend waiting 1 to 2 days, because sometimes if you exercise the same day, the blood pumping to the face and the increased heart rate can actually add to the swelling and bruising and increase blood flow to the areas that were injected. So we generally tell people to refrain from exercise that same day. Icing and arnica are generally what we want to do. We don't want to increase blood flow to the face, but most people can resume exercise within 1 to 2 days. The Juvederm products generally have a wide range of pricing and a wide range of the number of syringes that a person may need. As we get older, we're going to need more syringes to get the correction or the result we want. But in general, some of the thinner Juvederm products range from the $600 to $800 range per syringe, and some of our longer lasting Juvederm products are in the $900 to $1,000 per syringe category.